Screening programs are very well tested on USMLE exams, and you must know what are the characteristics of an ideal screening program. So if you talk about a screening program, so for example, we screen for colorectal cancer, we screen for breast cancer. So for a disease to qualify for screening, it is very important that the disease itself is very, very common. So when we talk about the disease characteristics, it should be a common disease and it should be a serious disease. When I say it's a serious disease, that basically means that it should have high mortality and it should be a high economic burden on the patients or the government, whosoever is paying it. So a common disease, highly prevalent disease, very serious disease, and also the disease should have a very long asymptomatic phase, which means that the disease should allow the researchers or the clinicians enough time to pick up the patient who are still in the asymptomatic phase. So a good screening program picks up the patient who actually is not the patient at the moment, so who is a healthy person but has the chances of disease being developed either in very early stages or a potential that you pick up the person, that the person is going to be high risk for that particular disease. So the disease has to be common, it has to be a serious, which means high mortality disease, a long asymptomatic phase should be there, and after all, once you identify the disease, there should be good therapeutic modalities available. So there is no point in identifying a disease and then clapping, yeah, we identified the disease, and then there is no treatment available. So that's not a good screening program. So whenever you have to design a screening program, the disease has to follow these characteristics. And then obviously I told you it has to be a very high prevalence disorder. And then there are some characteristics which are associated with the test. So for example, I say that we have a disease X. This is very common disease, a very serious disease. But then what about the screening test? Is it a very low cost test or very high cost test? So high cost is not a good screening test. It has to be a low cost test, right? And the test has to have a very high sensitivity and a very high specificity. Otherwise, there is no point. And then it should also be acceptable to a long range of patients. For example, if I talk about colorectal screening, so if I say, well, all the patients have to undergo biopsy of their large intestine, it may not be acceptable to a large number of persons, right? It's very invasive procedure, or sometimes there are, religious beliefs, there are socio-economic, ethical concerns, and patients just don't allow. So a good screening test should be acceptable in majority of the aspects by most of the patients, right? And then whenever there is a screening program which is being designed, it has to avoid over-diagnosis, it has to avoid different sorts of biases, and this then makes a very nice and good package for an ideal screening program. So remember, a common disease, a serious disease, long asymptomatic phase, acceptable to large number of persons, low cost, high sensitivity, and high specificity. So that makes a well-rounded and a good screening program.